Today, the top two questions that I get asked all the time. What the heck does a pediatric chiropractor do? Number one. And what the heck is a perfect storm? Number two. I'm a clue in on number two. It has nothing to do with a fishing boat or George Clooney. Stay tuned. I'm going to answer both of those questions in this video. And for parents who are struggling with children with ADHD, autism, sensory processing disorder, anxiety, epilepsy, or autoimmune conditions, you're going to want to hear the answer to this. You're going to want to know the explanation behind these two questions because it's going to help you finally get to the root cause of your child's health challenges. So mom and dad, if you're watching this video at 2 a.m. because you've been up all night trying to figure out how you can best support and care for your kiddo to give them the best chance possible at overcoming their health struggles, and you've already done things like detox, diet changes, you're sick of eating kale, you've tried all the different vitamins, you've tried all the supplements, you've got them under 2 to 3 different therapies, and maybe even a medication or 3, but you're still seeing your little one struggle. The Perfect Storm explains how early stressors and toxins show up in our kids' lives. They begin to wreak havoc on the function and development of the brain and the nervous system, which is kind of a big deal because it's the main operating system that controls and coordinates every other system in our body. Now, I got to tell you, I absolutely love it when a mom or dad has seen some of our material, gives us a call to kind of check if we're, just kind of crazy or absolutely crazy. And the first question they ask is, are you guys holistic? Yeah, just a bit. You're not going to put those e-stims on my child, are you? Heck no. And I'll admit, like many doctors and parents, originally, I was taught that genetics were the key to everything. In undergrad, I studied biology. In grad school, I studied neuromolecular biology. I looked at the way that gene expression affects tissues. I was in a very narrow-minded headspace, thinking that genetics were pretty much to blame for most health challenges, like autism or ADHD, that if it's encoded into your genes, you just gotta deal with it, and that's what life is. But the fact is, the more I started to learn, the more it didn't really make all that much sense. It almost seems like there was a big shift into blaming things like, it's the toxins and the chemicals everywhere. I mean, yeah, sure, you can always blame the toxins and the chemicals because they're atrocious, but again, it didn't seem to bring everything together as the why. But I will say, there are too many of both of those things in our environment and our lives today. Okay. And as a neurologically focused pediatric chiropractor, which I am now, you see my path diverted a little bit, I love to truly take the time to sit down with parents and really talk about things, to take a deep case history, to listen to what they have to say, and by looking closely at the real root causes of what's going on. And this is not just in kids' health challenges, this is in the parents' health challenges as well. And when we slow things down and take the time to really communicate here, we find 3 things again and again that parents are never really told about or not keyed into. And the thing is, it's because traditional medicine and the traditional pediatrician isn't really on this radar. They don't know about them and they don't fully understand them, so they don't talk about them, which translates into many families and children having the real root causes of lots of these things going on go unaddressed. Number 1. Pregnancy and stress. Both our clinical experience and the latest research show a link between stress during pregnancy and chronic health challenges that show up later in life. Now, unfortunately, in today's medical system, pregnancy is a diagnosis. We diagnose a patient as pregnant. And this diagnosis is in lieu of celebration and empowering this woman who is going to have a baby, which is a wonderful thing. We live in such a chaotic and stressful world that we find that much of baby's stress begins in utero and sort of sets the stage for their system to be stressed as they enter this world and further be built upon later on in life. It's important to remember that that connection, the umbilical cord between mom and baby, does a lot more than just give blood. Number 2, the second thing, again and again in these cases, is a high correlation with birth intervention or birth trauma, showing up in 85 to 90% of the perfect storm cases we see here at Synergy Chiropractic. The thing is this is not an isolated thing. This is beginning to be shown again and again in clinical research, which is great. It's starting to connect the dots between birth trauma and chronic health conditions later in life. And we're talking things like forceps, vacuum extractions, emergency C-sections, inductions, external versions, and other different types of manual assistance during the birth process. This puts a ton of physical stress, whether it be compressive or distractive, because both aren't great, on the delicate neurological centers of the brainstem and the upper part of the nervous system. And the important part of it is these correlate to the areas that control the autonomic nervous system, which, if you look at autonomic nervous system function, it is key in charge of controlling developmental and health functions like sleeping, eating, digestion, immune function, motor planning, and more, all sorts of things. Additionally, in this area, that very delicate, very mobile part of the upper cervical spine and the nervous system, we have the vagus nerve, which is often injured and interfered with via birth trauma. And now, with that, because it is such a parasympathetic rest, relax, regulate part of the system can't slow down. It can't relax. It can't digest. It can't properly process and regulate our stressful, toxic environment around us that our kids are growing up in. And number 3, the third piece of our perfect storm is common health challenges like colic and reflux, constipation, and ear infections as an infant and early on into childhood. Now, we say common because honestly, these things do happen a lot because all babies go through some layer of trauma as they're being born. And in cases where this leads to things like antibiotics and medication use, this wreaks havoc on the gut system, the immune system, and on other neurological development. There have been studies in the Journal of the American Medical Association, Pediatrics, that found that antibiotic use in the first year of life increased the child's risk of asthma and allergies in early childhood. There are also other studies linking their use to chronic health challenges like obesity and ADHD. So moms and dads, if you think a perfect storm is what your child is going through, and we're not talking about a fishing trawler out in the middle of the ocean, then you deserve to find out what it truly is and what can be done to help. We help families to overcome these types of challenges on a daily basis. So if you have questions, please reach out below, send us a DM, shoot us an email, give us a call, hop on our website, send us a carrier pigeon. I don't care. Get in touch with me. I'm here to help. You can register for our next Perfect Storm workshop where we go into more depth talking about what is the perfect storm and how do we help it. We do these in the evenings. They're informative. They're fun. It's a great opportunity to learn a little bit more. If you're interested in that, keep an eye on our social media. We're promoting them every time we do them. I can't wait to help you and your kids overcome this perfect storm and come out on the other side. Can't wait to meet you. I can't wait to see you. I'll see you soon. Take care.